Yeah. All right. Sorry. So you'll see when, oh, it's already in the red. Oh, that's going to be bad. This live stream probably won't work, but usually it starts out really nice and green. Because it's already dropped like almost 40%. That's not good. Oh well. We'll see what happens. Oh, now it's green. Okay. Yeah. I have a timer set for like 27 minutes, and I'll probably just like pause and we'll just stop it. Okay. All right. Welcome. The long anticipated presentation. For the third month in a row, we're trying to figure out the live stream. And so not only do I have to prepare the content, but I also have to be the IT guy. And it's, I thought I had it figured out, and I don't. So if there's anyone out there watching in the YouTube world that wants to donate their time and help me with my live stream, my contact information will be on the last slide. So welcome. I see some new faces. So for those that haven't met me, my name's Dan. I'm the pharmacist here. I've been a pharmacist now for 22 years in the making. I'm still learning every day about stuff. And we're going to be talking a lot about the microbiome tonight and how that interrelates with our brain. So the whole gut-brain connection. Why is that important? My wife and I, Monica, some of you probably know my wife Monica, who's also a pharmacist here. She specializes in bioidentical hormones. We just spent 4 days in Nashville, Tennessee, learning about the microbiome and how probiotics, prebiotics, all that interfaces with our cardiovascular system, with our endocrine system. So we're learning more and more how much the bacteria in our gut really can influence so many different systems in our body. So there's new information presented on Friday that talked about the cardiovascular system and how if we have dysbiosis in our GI tract, we could potentially be at higher risk for cardiovascular disease, heart attacks, and things to that nature. So that lining that we're going to talk about tonight, the epithelial lining, there's a lot of similarities with the endothelial lining. So that lining in our gut has a lot of similarities with the lining in our blood vessels. And so if we have bacteria that they're foes and they're not friendly, they're dysbiotic, they're producing LPS and other toxins, they can potentially start this inflammatory cascade in our endothelial lining to potentially cause blood clots. So there's a lot to learn about that still, but that's what I was learning about for the last 4 days down in Nashville. I also went down to Broadway and saw, oh my gosh, all the craziness down there. So that was fun too. So tonight, focus, mood, concentration, depression, anxiety, sleep, all of that could potentially be helped with a good probiotic. There's, just like in the pharmaceutical world, there's specific antibiotics that kill off certain bacteria. The way I think of probiotics now, it's not a one-size-fits-all. When I started pharmacy, I owned and operated Yield Pharmacy. Does anyone know Yield Pharmacy in Glendale? Yeah, so that's where I started. My mentor and father-in-law, John, started me out in this world of vitamins, and we sold a lot of Florigen at the time, and that was just a lactobacillus probiotic. It was one strain, and I would say it helped with patients that were taking an antibiotic and they had diarrhea or some type of side effect from that antibiotic. Florigen was a good choice for that, but we've come a long way from there. That was just one strain, and then Florigen ended up coming out with a multi-strain probiotic. And what we're learning is about these keystone species that we'll talk about a little bit tonight. When you get certain bacteria, they have certain properties. So just like an antibiotic kills off certain bacteria will produce certain, what we call postbiotics. They'll produce something in our body that's going to benefit us. And that something might be a short-chain fatty acid, it could be a neurotransmitter, it could be something that's going to benefit our body. So it all depends on that strain of bacteria that we might be ingesting. That's going to give us a certain outcome. So tonight we're going to talk about a probiotic. It's called, well, we'll get to it in a minute, but it's coined, the number of it is 1714. I don't know how they came up with this number, but it's a Bifidobacterium species, and we're going to get into the weeds on this and that particular bug tonight, and it produces certain outcomes. So that's where we're heading for about the next, I'd say, half an hour, 45 minutes, depending on how many questions we get along the way. So I will say, if you do have questions, just stop me. I'd rather just get them out of the way before you forget, kind of a thing. So if there are questions, let me know. This is more for the YouTube world, so my medical disclaimer, this is for informational purposes only. I'm not telling you to stop or start any medication tonight, nor can I. And especially with supplements, there's a lot of, in my opinion, value to these supplements. They're very potent and can be very potent and potentially interact with your medications that you might be taking. And so that's what that says. Check with your doctor before even starting any supplement, in my opinion. So, because you got to be careful too with some of these probiotics that are increasing serotonin in our body. There's something called serotonin syndrome, and we're going to be talking about depression tonight. Potentially that could lead to serotonin syndrome because you've got a drug that's increasing serotonin in the body. Now you're taking a probiotic that's increasing serotonin. You can get into hypertensive crisis possibly. So we've got to be very careful on what we take. So we're going to talk about the gut-brain axis. We're going to talk about the microbiome and how that interrelates with brain function, brain activity. I'm not going to get too deep into the research. There is plenty of it out there. There's much more that needs to still be done. So we'll look at a few clinical studies that did look at this particular strain of probiotic and what those results were. I'll get specifically into the products that we carry here, what the pros and cons of those might be, and then just some final takeaway points. So that is where we're heading. So has anyone heard of the gut-brain axis before? Yeah, okay, so not completely new. It's been out there for a little while anyways. We're still learning more about it, and so really it's a bidirectional kind of, how we have that gut feeling sometimes, or my gut tells me this type of thing. So that's where we're getting information from the postbiotics, if you will, what these bacteria are producing in our GI tract. They can be influencing how we feel, how we think, that type of thing. And then vice versa, though, our brain is producing, neurotransmitters and stores neurotransmitters, and those are then being sent down via this vagus nerve, this superhighway, if you will, and that's also sending information back to the GI tract. So there's a lot of different things going on. So there's a neural component, an endocrine component. Hormonally speaking, the biggest thing that I've seen is cortisol. So when we get in, not so much the sex hormones, which is what we deal with a lot here, but cortisol, our stress hormone. So when we get stressed out, our GI tract tends to take a hit. We'll look at how that microbiome can get disrupted with high levels of cortisol. So if we are under high amounts of stress, and we all kind of know this, we don't think as well, we have foggy thinking, we may not be thinking as clearly as we'd like to, and that could be potentially due to this cortisol. And then that's influencing the GI tract, causing this dysbiosis, potentially causing leaky gut syndrome, and then creating these bacteria that really have a negative influence on our whole entire GI system for sure. So it's that vagus nerve that these prebiotics are producing specific agents, we'll call them, they call them postbiotics, that are then traveling through the vagus nerve, or stimulating, I should say, the vagus nerve and sending information back up to the brain. And then from a neural standpoint, think of the enteric nervous system. So like if we have high cortisol, we have high levels of stress and cortisol, bless you, that's kind of, we've all been there, where then we get the butterflies in our stomach and that type of thing. We're like, there's a whole intervention of nerves going down into our GI tract, either maybe increasing transit time or decreasing it, so we can get diarrhea, we can get constipation. And so it's going to get, information's being sent both ways, back and forth between the brain and the GI tract. And then neurotransmitters, we probably know this already, but it depends on what you look at from a reference standpoint, but anywhere from 70 to even like 95% of the serotonin that is in our body is really made in the GI tract. So back to my old pharmacy days when we look at SSRIs or like Prozacs of the world or typical antidepressants, a lot of the way those drugs are really working is it's blocking the serotonin from getting taken back up into the nerve cell. The problem with that particular drug from a depression standpoint is you have to have serotonin there to begin with in the first place. So if you don't have serotonin, what are those drugs really doing? There's nothing that it's kind of like a dam, so to speak, or once the dam opens up and you've got all this water flushing down, or the serotonin going down the transmission line, well, there's nothing there that's being transmitted because we're maybe don't have the right bacteria that's producing the serotonin in the first place. So that's something where it's like, when I was going to pharmacy school, it takes potentially 6 to 8 weeks for these antidepressants to work. And in my mind, I'm like, well, why does it take so long? Well, maybe there's not enough serotonin in the brain to begin with to actually have any positive influence on our mood. So there's that. GABA, has anyone heard of GABA before? Or that's like the brake system of the brain. So right, we've got glutamate, which is excitatory, and GABA is more of that inhibitory neurotransmitter. And so again, the bacteria that we're going to look at specifically tonight can help with GABA response and actually helping to produce more GABA. And that can help, again, lessen our stress level, lessen our anxiety level. And then dopamine too. Sometimes we might get burnt out. We don't find pleasure anymore in the things that we used to. And so potentially that's because we're not producing enough dopamine. And that potentially could be due to maybe even being on a course of antibiotics that killed off good bacteria in our GI tract. So some of these things that I look at from a pharmaceutical standpoint, like how can taking an antibiotic for pneumonia or any type of infection then later cause depression or anxiety? Well, here might be the reason why, is because we've just killed off good bacteria that was helping to produce serotonin, that was helping to produce dopamine, that was helping to produce GABA. So here's where these connections start to come together. So the studies aren't great on all of this. I will say it's more of a correlation, so not a causation. That's the thing too that I want to take home tonight, is that yes, we're going to look at some studies that show a correlation effect, but it doesn't necessarily mean it's the exact reason why that outcome was achieved. So we'll get more into that in a few minutes. And then we talked a little bit about cortisol already. So stress levels, I always think of cortisol going up, our gut integrity starts to go down. So the more stress that we have, we don't eat as well. We tend to have more of a dysbiotic or bad bacteria start to flourish in our GI tract. So if we can help to manage cortisol levels in general, the better our GI tract is going to be able to function. So the more cortisol, the slower our digestive tract tends to be. So, and I think we all know that and it can go both ways. If patients get stressed out, some will want to eat more, some can eat less. Yeah, me too. When my stress level goes up, I don't make very good food choices. So I kind of mentioned this already, but stress alters gut motility, secretions, and permeability. So not only does it potentially slow down the GI tract, but we don't produce as much mucus, which is produced by certain bacteria in the GI tract. So we have that mucosal layer that's protecting that lining. And then our GI tract can become more permeable. So then we start absorbing some of these endotoxins. So let's just say we take an antibiotic and it kills off the infection, but the problem with that then is you've also killed off the good guys, and sometimes those bad guys can come back and flourish, like E. coli. I'll pick on like gram-negative bacteria. You take an antibiotic, you get rid of your pneumonia infection, but then all of a sudden you've got these bad bacteria like E. coli that have sprung up, and they might start producing something called LPS. We'll talk about that in a minute. And all of a sudden, this LPS starts to poke holes in your GI tract. And now you have a food sensitivity. Now your allergies get worse. So you start putting these connections together, all because you've taken an antibiotic that killed off good bacteria in your GI tract. So that's how some of these things are happening. Cortisol in the sympathetic nervous system activation reduce microbial diversity and encourage the growth of pathogenic species. So just by being in a stressful situation, our GI tract can produce more of these unfortunate pathogens. And it explains why when patients get stressed, I've seen this over and over again in the pharmacy. They come in, a stressful situation happened, and then they get an IBS flare. Their acid reflux gets worse. All types of inflammatory issues can cascade from that, from just being under any type of stress, either perceived or psychological.
I have a question. So that's second point about the cortisol and the sympathetic nervous system, its effects.
Mm-hmm.
How's the research with that? I mean, has that been shown in bacterial flora or washings or anything?
Yes.
Or is it theoretical?
No, that has been studied and looked at. So yeah, as their cortisol levels go up, their diversity in those patients has gone down. So they're actually doing stool samples, like measuring cortisols, yep, and then looking at their microbiome and physically seeing that their diversity of their microbiome has gone down and the level of the pathogenic bacteria has gone up.
I know we read about that all the time, but
it's actually
like we read how SSRIs work and we have no idea how they really work.
Yeah.
You know what
So,
I mean?
yep.
So that's been proven in the lab.
Yes.
Yeah, that's
yep.
real.
Yep. That's a great question. Yep. So. And then there's that. So definition. So there's two kind of new words here that for this seminar. So it's the psychobiome. It describes the interaction between a person's collective microbiome and their mental state. So something I've never really even heard of before until preparing for this seminar is that we have an arrangement of bacteria, which I'll show you a short list of them in just a minute, that are helping to produce a lot of different neurotransmitters in our body. And we've got to understand what these bacteria are doing to, I think, have a better general sense of what's going on from a mental health standpoint. We can't just look at neurotransmitters in the brain. We have to start looking at the bacteria that are producing a lot of these, or helping to produce the neurotransmitters in our GI tract, because those are directly influencing how we think and act and how our memory works and all of those types of things. So then a psychobiotic is just that. It's a commensal bacteria or a good bacteria that impacts the gut-brain axis and helps to positively support brain function. So we'll look at the Bifidobacterium tonight in the particular product that we have that we're going to look at very specifically, that helps to helps to lower cortisol, helps to improve serotonin levels. So there's a couple of nice studies that look at that. So, now, before I get into like the actual bacteria, I just want to really briefly the gut microbiome and how this all works. So we got there's only one cell layer thick in our intestines that keeps what we eat and what's in our GI tract from our bloodstream. And so we want to make sure that we're keeping those cells nice and healthy. And the problem is if we take an antibiotic, if we take my least favorite drug class in the world is PPI, so proton pump inhibitors, can disrupt this protective layer, and ultimately what can happen is we can lose microbial diversity. We want a lot of different friendly bacteria in our GI tract, and if we take an antibiotic, if we take a PPI, we increase our risk for losing that protective layer, and then ultimately what happens is it breaks down those cells, and once we get, almost think of like a gut ulcer or a GI ulcer. That's what's really happening here on the right-hand side, is that now all of a sudden we've got a leak, we've got a hole that's going from our GI tract directly into our bloodstream. And the problem with that, especially with going back to E. coli, is they produce a lot of LPS, lipopolysaccharide, which has a very negative impact on our, it's actually been linked to neurodegenerative disease, Alzheimer's, Parkinson's, where LPS can actually be found, it translocates and crosses the blood-brain barrier and can have a negative impact there. So we really want to make sure we have a healthy mucosa in the GI tract. We want to make sure we have low levels of pathogens, so low levels of gram-negative bacteria. I'm not saying that we should have none, but we should have, it's kind of like the story of Goldilocks. We don't want too little of the bad guys. We want some of them around there to keep ourselves in check, but we don't want to have too many of them. We want to have that mucosal barrier, so there's certain bacteria that produce something called short-chain fatty acids and mucin, and that helps to establish this mucus layer. We want to make sure we're keeping a strong mucosal layer. These tight junctions, those are actually there's something called occludin and zonulin. There's specific proteins that kind of weave themselves, actually in here as well too, but weave themselves in between these cells. We can actually test on a blood test here that we sell at the pharmacy that will actually look at something called occludin and zonulin. And if you have that in your blood, that's not a good thing, because those two proteins should actually be interfaced here in these cells to keep everything tied together. So we can actually look and see if somebody has leaky gut now. We can actually see, do you have occludin in your blood? Do you have zonulin in your blood? We can actually see if you have LPS in your blood as well too. None of those should be in there, but we can actually just do a simple finger stick, poke your finger drop some blood on a little piece of paper, send it out, and see if you actually have that floating around in your bloodstream, because it should not be there. Small amounts can be there, but there's certain levels and parameters. There's a spectrum there. So, and then abundance of keystone species. So I'm not going to get into all of these. Think of it like there's specific generals, if you will, of bacteria that are kind of helping to modulate and keep the good guys in check, and also to keep the bad guys in check. So we have certain keystone species that we can look at through a stool test that says, hey, do we have enough of the good guys, and do we have enough of the bad guys, but not too many of them around? We can start looking at those things. Look, if somebody takes an antibiotic, you can see, and this has been tested before too, where somebody takes an antibiotic and then all of a sudden their keystone species drops, and then their level of LPS in their blood goes up, or their level of occludin or zonulin, these markers for leaky gut, you can actually see that rise in their blood. So, all right. So just a couple of quick risk factors for dysbiosis. So I already talked about like antibiotics, so there's certain medications. So anytime we get in, even the infection itself can cause leaky gut. Excessive alcohol, hopefully that should seem obvious, but in just drinking alcohol on a significant basis could again lead to erosions. It can potentially even lead to GI ulcers. Smoking, and that's part of that too, is that it's just overall decreasing the function of our immune system. Stress, as we talked about, really mainly due to cortisol, excessive cortisol going up, that can actually help, that can erode that protective barrier. And then even natural antimicrobial. Somebody here just picked up berberine, or was asking about berberine. So berberine's a natural antimicrobial. There's a study that looked at berberine. There's a couple studies, but one in particular that I'm thinking about that looked at berberine and was actually, it lowered the amount of good bacteria in patients and actually increased the pathogenic bacteria. This is over long periods of time. So that's something to be aware of just with berberine, is that potentially could lead to dysbiosis, even though it's a natural antibiotic or natural anti-infective. So we have to be aware of those things. So sometimes I like to cycle on and off of the berberine and not take it continuously. So we have to be careful of that and just be aware of that. Lack of sleep, because that's probably due to the neurotransmitters getting off balance. You're not getting enough melatonin, serotonin production. When we have lack of sleep, potentially we have more stress, we're producing more cortisol, so there's a lot that can lead into that. Intensive exercise can also lead to dysbiosis. And of course, like too much saturated fat can also lead to that thinning of the lining. And then we talked a lot about in Nashville this past weekend about toxins and glyphosate. So those can be disruptive. I mean, glyphosate is a chemical antibiotic, really, is what glyphosate is, and that can erode and it does. It erode the good bacteria in the GI tract, and then leads to end up dysbiosis. So, and there's more. This is that list of the bacteria. There's a lot on here. You probably can't even see that from back there, but just know that there's multiple different species of bacteria that have been linked to producing these neurotransmitters. So we don't know everything about these bacteria, but just like lactobacillus, streptococcus, there's some good ones there. There's actually some good E. coli out there that can help produce serotonin. So it's not that all E. coli is bad for us. There's certain strains that are good. There's certain strains of E. coli that aren't great, or like Klebsiella pneumoniae. So again, it's got to be careful here, and look, we don't want to just kill off all of the bad guys. We want to make sure we have a good balance of all of these things. So dopamine, there's a couple of strains of E. coli that are actually helping to produce dopamine as well. Like our epinephrine, norepinephrine, or adrenaline, noradrenaline, the brake system of the brain, the GABA's listed there. There's multiple species. My point to this is we need to have a lot of good different bacteria, like multi-strain. Like when we're taking a probiotic, that's why I like to recommend a probiotic that has like at least 5-6 different strains of bacteria in it that are helping to produce a gamut of these neurotransmitters. So that's that. So this gets into some of the, how am I doing on time? I got about 3 minutes to the, has it dropped off yet? No? Oh, okay. Live stream's still going. Got about 3 minutes. I think it's going to drop. So for those that are at home watching this, I apologize in advance because I think the live stream is going to cut out pretty soon, but it is what it is. So I talked about LPS. That stands for lipopolysaccharide, or as I like to call it, little pieces of shit. So gram-negative, specifically gram-negative bacteria, E. coli like to produce LPS, and there's other strains too. But essentially that correlates with, there's a study here that correlates that with depression. So we can, again, measure and quantify the amount of LPS that is floating around in your blood and that has been correlated, and there's other things too, of course, but specifically LPS can cause, or not, I shouldn't say cause, I gotta be careful with my words here, but it can have a negative influence on our mental health. Maybe that's a safe way to put it, right? So in this study it says evidence that major depression is accompanied by the activation of the inflammatory response system, and that pro-inflammatory cytokines and LPS may induce depressive symptoms. So if I were to take this from just a real life application, I have somebody that, I'm just going to make up a story right now, but is depressed. Let's just say they've tried pharmaceuticals. Maybe they're working, maybe they're not working as much as they want to. Has their doctor or their psychiatrist ever tested their LPS level? Probably not, right? If you know somebody out there that's got depression, they've tried all the pharmaceuticals, nothing's really working, I would suggest going out and taking a look at your LPS level. Something very simple. I mean, you can literally get the kit here and do it. Not that I can prescribe, I'm a pharmacist, not a doctor, but the point is then you could take those results to your doctor, to your provider, or to a functional medicine doctor that knows about the stuff that I know and say, hey, let's try XYZ, or let's just try this probiotic or something, let's rebuild up your gut lining. So this looked at IBD. So depression and anxiety are prevalent among patients with chronic disorders such as IBD. So the point there is that these patients with IBD, IBS, they have a lot of inflammatory cascades that are going on. And then a lot of that, they also have these comorbidities, the depression, anxiety tends to go along with that. The point here is that their gut's probably in pretty rough shape if they have IBS or IBD to begin with. They probably have some level of dysbiosis, and that's contributing to this whole, they're not producing enough serotonin, they're not producing enough GABA potentially. So the other thing that we could do is, okay, we can heal their guts potentially and get their GI tract working correctly. The other thing too, though, is that with this depression and anxiety, we can actually measure, now this is from a systemic standpoint, we have another test here that can look at your GABA level. Now, not from your central nervous system, be aware of that, but we can start to, I think, in my opinion, draw some conclusions if we have a low systemic level of GABA or serotonin. That might be something we want to look further into and say, okay, let's maybe supplement with some over-the-counter supplements or something to help that patient improve their serotonin and their GABA production. And then this is the probiotic that we're going to talk about a little bit more tonight, but these two Bifido strains, I don't know where they came up with these numbers, but it helps to attenuate stress response. It actually helps to lower cortisol. Oh, that's my 30-minute, all right, pause that. This means that the YouTube stream is probably going to shut down. But it can help to attenuate or lessen that cortisol response. So it can actually help to pull down cortisol in healthy people and reduce symptoms of IBS. So, here's that Bifido longum 1714 again in another study. Modulated resting neural activity that correlated with enhanced vitality and reduced mental fatigue. So we're actually looking at this particular strain, this Bifido 1714, looking at it in a few different studies that's showing that it's helping to improve cognition, to improve mental acuity, essentially. And here's yet one more study. Bifido 1714 was associated with improvements in well-being outcomes related to sleep and feelings of stress. And actually, what it's doing here, and this is kind of in my nerdy world, helping to reduce neural inflammation, it actually helps to turn off NF-kappa B, which is kind of this master switch to inflammation in the body. And so you could take, it's just that little picture there is my little picture of the bacteria. But if we have LPS, which is turning on inflammation in the body, we can actually take Bifido, in this particular study, Bifido 1714, and that can actually block the inflammation that's created by NF-kappa B, which is, to me, is profound, because then you can kind of turn off this neural inflammation or attenuate or lessen the effect of the anxiety caused by the LPS, if that makes sense. So in my big picture world, this particular strain can help with anxiety, nervousness. It can help improve sleep, but I think that's just kind of the start of it. You'd still want a multi-strain probiotic on top of that, and other probably gut repairing products like glutamine and things to that nature to help improve that patient's overall GI tract. So I think of this Bifido 1714 as just one particular strain that has a targeted approach. Instead of like a shotgun multi-species approach, I think of Bifido 1714 as like a sniper almost, where it just has a very specific role in the body to help with neuroinflammation, to help attenuate the LPS. And then this is the mechanism that was described to help. How does it do it? It turns down inflammation. How does it do that? Well, it blocks LPS. It blocks NF-kappa B from turning on other inflammatory switches in the body. So another study that looked at 1714. This was again a smaller study. I can't remember how many patients were in this one. Only for 4 weeks. Looked at anxiety. So we'll look at that in a minute. Perceived daily stressors, and it actually looked, going back to your question about cortisol, it actually measured cortisol output. And so looked at, there was a baseline of the patients, there was a placebo group, and then the treatment group. And really this is where they were looking at cortisol output, and their cortisol levels actually went down after from the treatment group. And then this is just a picture of the Bifido 1714. We sell it under the name Psychobiome mood. But this is what's in there. So it's the Bifido 1714, a little bit of B6, a little bit of B12, saffron that's got a little bit of research. It's not like the, I kind of call it, that's kind of the fluff part of the product. It does a little bit to help with cognition and helping to improve mood, but really the big player there is obviously the Bifido 1714, in my opinion. So it's clinically studied to help support brain health, mental well-being, improves stress response by helping to lower cortisol, and helps with that gut-brain balance. I would say you would still want to take an overall broad-spectrum probiotic. Helps with the mood balance, helps to produce those serotonin, melatonin, helps with GABA response. Helps to improve quality of sleep. It also helps to improve duration of sleep. It looked at, there's a sleep study that was done. It helps patients fall asleep faster and stay asleep longer, and helping with cognitive clarity. The B6 that's in there, this is a picture I took from one of our neurotransmitter tests. So you can actually do a neurotransmitter test here as well at the pharmacy that you can take home. It's actually a urine test. And so what it's looking at is the different neurotransmitters and their metabolites. And B6 can help with a lot of the neurotransmitter production. So not only just taking, that's why it's combined with the Bifido 1714, is that it helps to get to these end products, looking at the serotonin, the melatonin, helping with GABA as well. So, and then there's I don't think I included it, but it also, B6 can help with producing norepinephrine and epinephrine. So if you have somebody there that's depressed, they don't take pleasure anymore in like their hobbies and their activities, maybe they just have low dopamine. Maybe they kind of burnt out their dopamine response. And so B6 can be helpful with that. And then B12, I always think of B12 as, there's a lot to talk about. We could probably talk a whole hour on just B12 alone with methylation, but it's a water-soluble vitamin, helps with a lot of neurological function and inflammation issues, helps to convert tryptophan to serotonin so that we can measure those actually now. The big thing too with B12 is it helps to manage homocysteine. So not from a gut side per se, but from a inflammation standpoint, B12 helps to lower homocysteine levels in the body, and homocysteine's been, again, correlated back to increased risk for blood clots. If you have too much homocysteine in your body, potentially can run the risk of neurodegeneration as well. So I've got to be thinking about those things. So, and then here's that saffron that I talked about. Again, there's not a lot of great information out there. There's a little bit that helps with cognitive and mood support. So if you're looking at something to like take on, we can actually measure homocysteine levels. So if we have somebody with a lot of neuroinflammation, and we can actually measure your homocysteine, something that would be an add-on on top of a probiotic, especially the Bifido 1714, isn't going to do much alone to help knock down homocysteine. You're probably going to want to take a B complex on top of that, usually even upwards to 50 to 100 milligrams of B6 and B12 would probably be what that patient would particularly need. Final takeaways, gut-brain axis is biodirectional. So the brain, what's going on there is impacting the GI tract and the enteric nervous system, and then vice versa, what's going on in the GI tract is affecting our mood and our brain, our cognition, so it's going both ways. They're working off of each other. Diverse microbiome can help maintain central nervous system, digestion, and mood. So we want to make sure that we have diversity. We have those keystone species. We can do a stool test to see if you have those keystone species, and if you don't, we have specific probiotics outside of the Bifido 1714 that we can help you take to improve that diversity. But Bifido 1714, again, it's a well-studied probiotic. Again, I mentioned 3-4 different studies here tonight. There's more out there. There's more coming. Which is good. More data, I think, is helpful to help with stress management, to help with sleep. You can actually just take Bifido 1714 for somebody that has insomnia or has a difficulty falling asleep. It's been shown to help with those sleep issues. So, and I think that is my last slide. So, all right. Kind of ran through that pretty quick, but any questions? I'm going to go back to that one there. Oh, yeah. Is the live stream still going? Oh, it is. I'm going to shut it off so we can speak freely. So I'm going to say goodbye to the YouTube world. I'm going to turn this off. I already got one strike against me from the YouTube world, YouTube police.